Let's learn how to drain the lymphatic fluid from our face and neck. I specialize in lymphatic drainage and I want to show you how to properly drain the fluid from your face and neck. Make sure you have clean hands and a clean face, and let's get started. Okay, I'm gonna first take off my wrinkle patch so you guys can see what that looks like when I first wake up. So with clean hands, get ready to swallow, get ready to look snatched. You're going to take the flat surface of your hands, and the motion when it's on you is like this. The motion's like the ocean. So make sure that you actually have the technique down of how to pump these lymphatic ducts. They're a one-way pump. So they pump like this and nothing can suck back in. So we're literally going to be milking our face right now. So you guys should know by now the first place we're gonna start is the terminus, and we're gonna open up the upper lymphatic duct. So with the flat surface of my hands, I'm gonna go right below my clavicle right here, right where this pocket is. And I'm just gonna begin to gently pull the skin down. You may see me swallowing, and that's a good sign. And you may be swallowing yourself. Some people actually have slower lymphatic systems. Some lymph fluid is more viscous, some is more watery. So the more you play with your lymphatic system, the more you know what is normal for your lymph system. So I'm just going to be gently pulling down on this skin, almost just like coaxing it like this. And you can kind of move back and forth. Another benefit you can do while, go ahead and cross your hands and place it right below the angle of the jaw. You can also start humming while draining your lymph. Vibration is very good for your lymphatic system. So I often will hum. The vocal cords will vibrate, and it's just extremely beneficial to add any sort of movement to your lymphatic system. Swallowed again. So I'm going to kind of spend some time really working it here. Very slow touch. General rule of thumb is 5 grams of pressure, which I don't know how many people actually know what that is. It's not a lot, just enough to move the skin. I already feel my sinuses clearing up from sleep. You can go alien hands or peace hands and slide your fingers on either side of the ears. And this is like the third major point on the upper head and neck. We're kind of lubricating and taking tension out of the fascia on the face, ears, and neck. I actually feel this in the front of my eyes where I'm quite puffy this morning. So really spend some time getting in this area. You can go right in front of the hole of the ear, kind of above the jawline, and gently pull down. Again, you can hear me swallow. So we're gonna work from the middle of the face out to the sides. Think of it like a waterfall. So the lymph is gonna wanna go out and down, and then out and around. So all the lymphatic fluid will drain to the posterior side of the body and come back over this left shoulder mostly, and drain all that fluid that it picked up back through the heart, and it will be distributed back into the bloodstream so all those organs can do their job and filter it out of your body. The next spot I want to hit is right here on the sinuses. If you kind of have like postnasal drip, or you're prone to sinus infections, or you feel like you're only breathing out of one nostril, really spend some time here. There's going to be like almost a little pocket right here on your cheekbone in front of the nose. And I want you to spend some time wiggling it about. This area you can use a little bit more pressure, but don't push too hard. I know sometimes that might feel good, but right now we're not focusing on muscle tension. We're focusing on fascial tension and opening up those lymphatic pathways, which are right below the surface of the skin. So you don't want to use too much pressure. So as you can see, I'm kind of wiggling and just literally following this cheekbone here, and you want to start from the middle and move out. So I'm really going to spend some time here. The next place I want to travel to is right at the tip of each eyebrow. Once you get on there, you may feel like a little hole or divot. And this is where all the mucus from the sinuses are produced, right here and right here. Now, this area could be really tender. I know right now it is for me. Again, you can use a little bit firmer pressure here, and then you're going to swipe down. I want you to almost like you're swiping dust off. See how I'm not even pulling the skin? Like you can't even really see the skin get dragged. Like you're sweeping cobwebs off your face. Pretend you just walked into a dirty basement and you walk through a bunch of cobwebs and you're swiping them off your face. So I can already tell on me the puffiness has gone down. Again, very little light clawing motions. You can also take the pinchers of your finger and start here. So once you kind of open up those sinus points, we're going to start working the lower jaw first. Because if we don't open up this, none of this will properly drain down to the vena cava at the terminus here. We're going to take our two little fingers and our thumbs. So we're going to start with our thumbs. This little pocket under the chin is where a lot of us will get fluid stuck. So you're just going to kind of use this motion and gently wiggle and massage. And then I like to take what I call piano fingers, and you're going to follow right under the jawbone and just kind of poke upward, swallow it again, and wiggle. And we're just slowly moving that lymphatic fluid from the middle of the face out to the sides. You may find yourself sniffing, swallowing, stomach gurgling. You can add some humming in there if you like. And then I'm going to take my peace signs, the backs of my fingers, and I'm going to start on the chin and move that fluid back to the angle of my jaw. I'm swallowing a lot. And then just swipe. Then I'm going to take my peace signs again. I'm going to kind of wedge my lip here and pull all that fluid from underneath my nose and underneath my bottom lip and pull it back, creating that waterfall effect. Always, whenever you feel like during any lymphatic routine, return back to the terminus and open that area up. Always give it some extra help. Again, this is going to help with reducing neck pain by creating better lymphatic flow and taking the tension out of the fascia on the neck, head, and face. So I'm going to return back. Now that we worked kind of this lower jaw and opened up the lower part of the cheek, we can go back to that first spot where the sinus is. And you're going to follow your cheekbone and just kind of swipe down, up under the bone, and then down the side of the neck. So if you have more puffiness here, spend some extra time. Look how light I'm doing. Like, this is such delicate skin under the eye. You barely want to move the skin. This is such a light touch. Very, very light touch. It's right below the surface. We're now going to go on top of the eye. So I'm going to hit those sinuses one more time with a little bit firmer pressure. And again, you should feel like little tiny divots right here. There's little holes where the sinuses come out. So again, very light. I'm going to kind of take the cup of my finger here and just lightly press into my eye socket. So I'm going to use really light pressure. Again, I'm swallowing a lot. Your eyes have a lot of fluid in them, and sometimes they may feel tight or like you have pressure behind them if you're someone who deals with headaches, especially like up in the sinus area. And moving all that fluid will help a lot with the pressure of your headache. So again, very, very light touch, and always down the side of the neck. And now I'm going to go up the forehead and swipe out. Again, like I'm swiping dust or dirt or cobwebs off my face. Very, very light. We're going to go down the bridge of the nose and then out through the sinuses. Spend as much time as you need on your face to feel like you've cleared everything. And then we're going to quickly actually move to the back of the neck. You're going to use kind of like the cup of your hand, and I'm going to use this pumping motion and then a swiping motion. So the back of the neck and the back of the head can hold a lot of fluid. You see me swallowing. So I'm just going to kind of pump that little crevice on the back of my neck, and I'm actually going to kind of press down on the top of my skull lightly. You see me swallowing again. Swipe the face, and then the back of the neck, I'm going to pull that up and over the shoulder on both sides. And then again, this motion. That's how light it should be. And then just swipe. You can also use the crook of your finger right here and swipe. We're not pulling skin. We're lightly swiping it across the surface. I already feel like less pressures behind my eyes. And then the last place we'll go into that pec minor, right under that little crevasse of the armpit. Give it some swallows. Somebody commented, should it pit instead of puff? Everybody has different armpits, but generally, yes, you don't want puffy, hard armpits. If you do feel some harder lumps in there, girl, get in there. Massage that thing out. You got to liquefy that hardened tissue, which can happen from fascial restriction. Like the fascia pulls and gets tight, and then it pockets those little lymphatic ducts, and that stuff can harden. So you got to work into that and kind of remilk it. You can swipe across the chest laterally down towards the heart, kind of any way here, and really just help guide that fluid you pulled from the center of your face down towards the heart. So that's how you drain your upper face and neck. You can add in some of those stretches we showed the other day. So placing your finger right below the clavicle, gently pulling down on the skin, looking up and away, and biting the air. And we can do that on both sides. This is a really good thing to do right in the morning. You're gonna feel a nice stretch on the shoulder too. So look up and away, and bite the air. And then we'll do one in the middle. This one's my favorite. You can go side to side. You can keep that skin pulled down and do some neck circles. You can go here and here, or pull and lean. And then you can pull down in the middle. Tuck your chin, tongue on the roof of your mouth, and look down. And then side to side. So that is your routine for your upper face, head, and neck. Let me know if you have any questions below, and I'll try to film another video if I didn't go over any of the questions you have.